Hello everybody, my name is Reagan Archibald and I'm here to talk to you more about thyroid hormones and digestive health, and I want to help you get to the underlying cause and link up why you may have had labs that show that everything's normal but you still feel like garbage. So my goal today is to help transform your thinking when it comes to thyroid conditions. And you may have gotten our first training video on thyroid, and hopefully you've read your report as well. But I want to give you some more detailed insights on what's going on in thyroid health, what's going on in the medical world, and just let's dive into why you still have the symptoms, why you're not feeling better, why you're not losing weight, why your libido is not back, and why your thyroid's doing what it's doing. So when you're looking at labs, a lot of you have come to my office and you've said, you know, we have been to every doctor and everyone looks at my labs and they say they all look normal, or now that you're on Synthroid, your labs look good, or you're on Armor Thyroid, or maybe you're on Westroid or a more natural version. But in general, we want your thyroid functioning on its own, with or without a medication, ideally. So, if you look at your labs and you've been told that everything is normal, well, the first thing you have to realize is that lab ranges are inaccurate. What that means is, with most labs, they'll take a general consensus, 95% of the people who have come to that lab, as long as you fit within 95% of those people's lab ranges, that's considered normal. So if you look at 95% of the American population, that's not good, because 95% of us, unfortunately, are not healthy. So we use bell curves that are just not accurate. We need to narrow the parameters. So in functional lab values, they're more sensitive. So we don't let things go until they become a full-blown disease. So one of the reasons why you may have been told, like, oh, everything looks normal, and then finally you show up, and after 6 years of looking for answers, because you've had the depression, you've had the hot flashes, the mood swings, the thinning of the hair, the cold hands, the cold feet, the irritability, the hanger, you get so hungry or angry. You've had all those things that show up, but you have never had somebody that actually took the time to substantiate what you have going on in your body. And so what we want to do is look at your labs, we narrow the parameters, we look at multiple systems and how they all interrelate, because there's so many complexities in the human body that there's not just one cause and one treatment, but we have to look at the whole picture. Because the way that we're treating thyroid uh, conditions right now is typically through Synthroid, and that is the #1 most prescribed drug right now, which, yeah, I mentioned earlier. So it's burning out your thyroid. It's a hormone replacement that in some cases can be very helpful, but for a lot of you out there, there's a better answer, and especially if the Synthroid is not changing your symptoms, because prescribing this hormone replacement it's a 50-year-old model. And what we've learned, especially in the last 5 years, I mean, the medicine of the future is where you actually get your body fixed by looking at the underlying cause. And so we'll talk about some of that today. But some of you may be frustrated because this is you in your 20s, and this is you in your 30s, and then your 40s, and now your 50s, and you're going, what is going on with me? And it's not until you're 50 or 60 when you can actually start treating your thyroid, because the medical profession, their hands are tied, because they cannot prescribe a medication unless there's a diagnosis. And you can't have a diagnosis if your labs are normal. So that's where you may have been on antidepressants for the last 20 years, even though it was a thyroid issue. Or we have a lot of our patients on antidepressants who, what they have is a digestive issue. So let's dig in a little more and talk about what the most common symptoms are. But if you did not get the last training video on thyroid, get that, because I talk a lot about why thyroid body types you'll put weight on everywhere, whereas if you're a liver body type, it may not be everywhere. But the 10 most common symptoms for thyroid issues are fatigue. And then you go poor concentration, poor memory or motivation, difficulty losing weight. You wake up feeling tired. Bloating. 69% of our patients surveyed said, yeah, they had bloating. Irritability, anxiety, rundown, joint pain and stiffness, and then body aches. And so, why fatigue? Well, the thyroid produces about 93% of your T4, your thyroxine. And that thyroxine gets converted into T3, which is an active thyroid hormone. And as long as you have enough T3, every cell in your body has a mitochondrial center. That's like the energy storehouse in your thyroid. So you probably remember from like high school biology, the mitochondria, that's like the power pack in your thyroid. And as long as you've got that power pack being adequately supplied by the T3, then your energy levels can come up and you start feeling like a rock star. I mean, you got the energy you need, you can eat whatever you want, and it all burns, it all gets burned off. I'm sure a lot of you have enviously looked at some of those clowns who just eat anything they want, and they never put on a single ounce of weight. And that's typically because their thyroid and their T3 conversion is efficiently happening so that all the cells in the body have energy, have mitochondria, and that's why that you get the fatigue. Thyroid can make it difficult losing weight, obviously, because you have no metabolism. You're going to be bloated because the thyroid relates to your digestive system, because a good portion of the T4 that your thyroid makes gets converted to T3 in your digestive system. So if you're getting bloated and you've been told you have a thyroid issue, we need to look in and dig deeper and find out, well, is that actually related to a digestive issue? So if you look at our country, we're in a health crisis, and a lot of it's because we have wrong or lacking information, especially when it comes to thyroid issues. A lot of you have been told that you have hypothyroidism, and when in fact you may have hypothyroidism, but what is the cause? And usually the cause is due to something else, something that relates to other systems in your body. So I want you to do a little exercise here and look at your tongue real quick. Just, you can push pause on this, or you can um, just grab a mirror and look at your tongue, and you'll see the tongue is like a map of your body. So just by looking at the coat on your tongue, we can see if you've got issues in your digestive system. By looking at the coat on your tongue, we can also see if your thyroid is a problem. So if you have a swollen tongue, it's a pal center, you might have a white coat, some teeth marks on the sides. That can be thyroid issues. If your sides are also red and they look kind of inflamed, if you've got cracks down the center of your tongue, that could relate to food sensitivities. The red inflammation could be a fact that your liver is not processing thyroid hormones efficiently enough. If you've got a real red tip in that hard area of the tongue that you can see there, that relates to the adrenals. So there could be an autoimmune component to your thyroid. If you don't have a white coat and it's a thick yellow coat, then that could be when you have what we call dysbiosis, or not adequate levels of good bacteria in your gut. So that could be caused by what we call leaky gut, and we'll talk a little bit about that. But as you can see here, the healthy intestinal lining, it has these what are called tight junctions, and so those tight junctions, they keep in all the waste, because in the intestines you do not want the waste getting into your body. You only want nutrients, and so the bacteria in your gut are actually what cause your body. They're the ones making all the vitamins and nutrients for you. So no bacteria, no nutrients. No formed stool either in most cases, or you get constipated, no bulk in your stool. So this intestinal lining, if you have a damaged intestinal lining from too much inflammation, what happens is you start to get what's called leaky gut. So you have proteins that leak through those tight junctions, and 70 to 80% of your immune system is surrounded right around your intestinal wall, because there's so much foreign agents coming into your body when you eat. And so what happens is then you get this harmful bacteria that starts to overgrow. You can have the yeast or fungi. You can end up with parasites. And what happens is if you don't have adequate levels of good bacteria and a proper diversity in your colon and in your digestive tract, then your body cannot convert T4 into the active thyroid hormone T3. So challenging your digestive gut on a regular basis is not a good idea for any of you who are trying to fix your thyroid. Or if you don't know that you have a thyroid issue and you just want to get better health, then one of the main things we're finding in the research is that fixing the bacteria in your gut has dramatic health consequences. I mean, you'll get if you've got proper diversity, you've got no infections like yeast overgrowth or parasites, you will feel so much better. Um, so, what are some of the consequences? I mean, if you have leaky gut, you're going to have trigger of the immune system. You'll have an insufficient production of hormones like your T3, your thyroid hormone. You can have issues with neurotransmitters. So that's where 90% of your serotonin's made. And so you could get depressed. And depression's a big deal. You can have an impaired absorption of vitamins, amino acids, minerals, and then an increased chance of abnormal bacteria and yeast overgrowth just from leaky gut. So a lot of you are probably saying, well, what's going to cause this? And you probably won't like my answer, but what causes it, from what we found, is there could be gluten, could be a trigger. In 80% of you, you're going to have a reaction to gluten. It could be from dairy. The casein in dairy has shown in research to cause a reaction by our immune systems. Corn. Most corn and soy is not the same corn and soy that our grandparents were eating. It's been genetically modified. It can actually be very allergenic to our bodies. Eggs, they can be one. And then peanuts. Peanuts have an aflatoxin in them, and they harvest yeast, which causes further dysbiosis, further disruption of your normal gut bacteria. So let's talk about some ways we can get help when it comes to the thyroid. If you do have a true thyroid issue, first of all, we want to find out what's causing it. Is it autoimmunity? Is it digestion? Is it your liver? But once you find out, here's some general recommendations. You can add foods that are rich in iodine if you don't have autoimmune issues. If you do have autoimmune issues, iodine can actually exacerbate the problem. But eat seafood, alfalfa, even raw cow milk. I know if you don't have a reaction to casein, that could be safe. Eggs, seaweed, nori, yogurt, fish, those could be good things. Don't wait until you're hungry, because you've got to make sure that you've got good blood sugar stability. Don't go more than about 25 grams of protein, because your thyroid can't handle too high levels of protein, because otherwise it will shut down your liver. Lots of good fats are great for the thyroid. It needs some stable energy sources. Foods you want to limit would be like almonds, corn, millet, peanuts, canola oil, pine nuts, pears, turnips, cabbage, kale, peaches, soy. The isoflavonoids block the iodine. Spinach, Brussels sprouts. A lot of the foods called cruciferous vegetables have goitrogens in them, which can lower your thyroid function. But if you cook those vegetables, especially your spinach and your kale, those would be very helpful for you. You can tune into my podcast at Go Wellness Radio and on iTunes, and I have all these foods and how to prepare those. But there's a lot of things you want to do, because when you're looking at what's going on with your thyroid, you have to say, well, what is depleting the function? Is it gluten? Is it grains? Is there leafy greens that you're eating that could be causing a problem? Is it too much iodine? Because if you have an autoimmune condition, that can flare it up. Is there extra T3? Is your free T3 too high and not getting into the cells? Are you becoming T3 resistant in your cells? Is it from hormones, synthetic or natural? Is it from too much alcohol or eating the wrong seeds? Because a lot of this if your thyroid's toxic, that's going to be a problem. You're not going to absorb that T3 that your thyroid is making. And what is going to provide the toxicity? It could be the bromide, which is in pesticides, dyes. It's also in breads. It's one of the main preservatives in bread. It's in personal care products, and it's loaded. You'll find it a lot in prescription drugs. You'll find a lot of fluoride in prescription drugs too, especially Prozac. Prozac is 94% fluoride, so it's not good for your thyroid at all. It's in toothpaste. Fluorine's in toothpaste, drinking water, beer, wine, soda. It's in insecticides, cereals. And then we all know about chlorine. That's another halogen molecule that can really disrupt your thyroid function. And it's found in pools, tap water, packaging for foods, spas, once again, prescription drugs, and then it can also be in solvents. So when you're looking at what's going on with your thyroid, you want to test and not guess. So you want to look at your testosterone levels. These are levels based on a male profile. So men, we want you to be between 500 and about 1200. This cortisol value, this is really important because cortisol is an alpha hormone, and if it's not regulated, that's going to affect your thyroid. So cortisol follows a circadian rhythm, and it's going to be a little higher when you wake up in the morning, and then it will start to drop down as the day goes on. So when you're looking at cortisol, if you can get your adrenals healthy, then you can start treating your thyroid. But first, treat the digestive system, your liver, get all the detoxification pathways opened up, and then balance your adrenals, and then start treating the thyroid. So in our approach at East West, we have a lot of different things that we can do to get to the underlying cause if you're looking for help. I mean, the very first thing that we do is we order the correct test. That's going to be a hair test where we look at micronutrients and food sensitivities. We'll order a stool test for you so that we can analyze what the yeast levels look like in your gut or how your bacteria diversity looks. We'll look at correcting your body based on treating the cause, not just focusing on the symptoms. And then we address your body as a whole because we're not going to just say, oh, there's one cause and one disease, because there's multiple causes and they have multiple origins. So, once again, we want to look at all the systems in your body. And then we give you a systematic approach. So it's an ABC 1, 2, 3 approach that anybody can follow no matter what your age is. I mean, one of our older patients, she's 94, and she actually told me, she said, you better work fast. And so I'm working as fast as I can, getting her healthy. But we provide mentoring as well, because I find that if you want to learn a new skill, you want the best mentors. You want world-class mentoring, and that's what we provide. We give you mentoring from Eastern medical doctors, Western medical doctors, nurse practitioners. Everyone at East West, we're trained in functional medicine, so we focus on getting to the underlying cause and using the proper approach in getting your body off some of these medications that may not be necessary. And we look at getting you the right stuff. So there could be supplements, there could be herbs. We give you a plan of action that once again is based on what your labs reveal. But when we do this, we put together the missing pieces. We put together, give you proper detoxification advice. We get the right nutrition based on your body type. So if you've got antibodies affecting your thyroid, then we're certainly going to want to say, avoid kale for a while or cook it. Cook your collard greens or mustard greens. Get some good sources of fats in. But once again, we have to find out what the problem is, because if there's no antibodies, then we want you eating more iodine. Eat the seaweed, eat the kelp, take some supplementation of iodine. Once we get nutrition, we have to balance the hormones. We have to look at the adrenal profile, look at all the thyroid hormones, and then we design a fitness program and an exercise program that's based on what your body can tolerate. And then the fifth pillar of health is what we call brain health, because if you've had whiplash or a concussion, if you have inflammation around your vagus nerve, all those things will diminish your thyroid's ability to function. So what we do is we put the missing pieces together, and then we give you a system that you can follow. And what I found is that, if you have a system, if you understand why you're making the changes in your life that we might ask you to make, it's easier to understand. It's easier for you to follow through if you have the whys versus just using willpower. So we always say it's about having a plan. It's not about having willpower. Focusing on willpower, I don't know about you, but for me it lasts until, that next cool thing, that next piece of chocolate cake or muffin. So once you know the whys, then it's easier. I mean, you know how you'll feel if you eat that chocolate cake or if you eat that muffin. You'll know it's not going to make you feel good. And so initially, you'll have to be a little tighter on your diet, but then it doesn't have to be so stringent. So you want to ask yourself these questions, how would life be if you're able to resolve your health issues? How has your life been affected right now? Your relationships, your ability to work, your ability to enjoy life. And then finally, on a scale of 1 to 10, how motivated am I really to take care of my problem? Because you know that no doctor can heal you. You've got to heal yourself. We give you the guidance, we give you the mentoring, but if you don't meet us halfway, then there's no point. So we tell people that we don't accept everybody into our program because our programs, they can be 3 months, they can be 6 months, they can be 12 months. But our programs are comprehensive. We put everything together in your program so that you can get the entire amount of care you need. We don't like to take shortcuts. We don't like to leave stones unturned because if you can really dig into your health for a few months, it is incredible the amount of transformation that you'll have. And literally, we've never had anybody who's followed through on our recommendations and actually gotten the care they need that hasn't gotten results. So as long as you're willing to do some of the things we ask you to do, and then don't do some of the things we ask you not to do, there's no reason why you won't get results with us. So when you're looking at this, you have two choices today. So if you haven't called and scheduled an appointment, we want you to do that. Don't be like my cat. Don't procrastinate any longer because it's easy to procrastinate. Our brains always talk us out of things. I mean, there's so many amazing opportunities in life, and there's so much to live for. So many reasons, if you're to die right now and look back on your life, I mean, think about all those impactful things that have gotten you to where you are today, and think about how you want to be remembered. Think about what you're living for, your kids, your grandkids, your significant other, maybe that next camping trip or the outdoors, but all those things are so impactful when it comes to our health. So we offer is for you to come in, and we spend about an hour. We go through your complete consultation, wellness evaluation, and we look at labs. If you've got labs within the last 6 months, bring those with you. Bring a support person because, once again, this is a lifestyle change. And then if we find that we can help you, we'll put together a plan of action that's going to get to the underlying root cause. Now, if you think about this, we'll spend about an hour. How much time do you get with your doctor if you, in fact, get to see your doctor? Most of the time with Obamacare, that 10-minute visit's been shortened to 7 minutes just so they can make ends meet. But, we're gonna spend the time that's needed. We're not gonna sit across a desk or intimidate you, but we're just gonna really analyze and evaluate what's been going on, what's causing some of your conditions, and then we'll order the correct tests if we decide it's time to move forward. And if we both feel good about it. So all you need to do is, call the office. The value of this visit's well over $287. We're just going to charge you $87. If you have a spouse or family member or friend who you'd like to bring, then it's just $47. If you want to bring in your entire office, then they're welcome too, because I know that your health has such an impact on other people, and likewise for you. I mean, you're probably listening to this video or watching it and saying, you know what, there's so many people who they're looking for answers or looking for help. I mean, you can see the anxiety in a lot of people's faces, and you can feel it when you're around them. So, our goal is to help. So hopefully today I've added some value. I've given you some ideas when it comes to your thyroid, and I really look forward to seeing you. All you need to do is call the office below or send us an email, and we will get in touch with you just as quickly as we can. We have offices, in St. George and Salt Lake, in West Valley, Ogden, and then our newest clinic is in Park City. So I'm honored you took the time to learn more about your health and your thyroid, and I look forward to seeing you in the clinic or hopefully just join the conversation on my podcast at Go Wellness. Once again, my name is Reagan Archbald, and it's been a pleasure to be here with you today.